This is the Harrison County Hospital Ivy Tech Paramedic Consortium Field Preceptor Training Program. Our paramedic program is a partnership formed in 2011 between Harrison County Hospital and Ivy Tech in Sellersburg, Indiana. This training program is required for our program accreditation. So let's get started. Thank you for being interested and willing to take part in our paramedic education program. Being willing to be a preceptor, you're taking an active part of training the future of EMS. Being a preceptor is not a passive position. Preceptors are an active part of training the next generation of professional EMS providers. This training program and the Preceptor's Manual has been produced to serve as your guide and to bring you into a new field of responsibilities, into a new realm of possibilities to become a preceptor. Please take the time to read the manual carefully. You are not alone. Please seek counsel from the program director frequently. Ask those questions. What is the best way to get X or Y or Z across to the student, and how do you deal with a difficult intern? The program director will be with you every step of the way. Whether your shifts are 12 hours, 24 hours, or some other variation, take the time to practice with your intern. Let them know what you expect as a preceptor and what you expect of them. If you find weaknesses, take the time to work with your intern. Many field medics have a story about how his preceptor tore him up over a seemingly minor transgression in what was deemed to be part of the process of toughening up a new recruit. In fact, many medics can recall someone who was flushed out, and those who remained the survivors became more cautious, even fearful, that they too would suffer the same fate. The study of modern paramedicine has changed from the old days. If paramedics are to become the professionals that we've always wanted to be in the eyes of other healthcare professionals, our educational process must change. Our educational process must become more academic. As such, our preceptors must also become more academic. Throughout this program, you'll be asked to do things that might seem silly, stupid, or even a waste of your time. But these actions are necessary if we are to progress as a profession. In its quest for national accreditation, the Harrison County Hospital Ivy Tech Paramedic Consortium has chosen to embrace this new educational process. As such, as a preceptor for Harrison County Hospital and Ivy Tech, you are being asked to embrace this new process as well. Your cooperation and willingness to be a preceptor is greatly appreciated. A preceptor's responsibilities can be broken down into three simple essentials: duty, service, and honor. The preceptor has a duty to educate those who follow. The preceptor must be prepared to give service to the student as an educator. This is how the preceptor will spend the majority of their time. And to maintain honor in the profession, the preceptor must sort out those who would aspire to join them from those who should not. The last responsibility cannot be taken lightly. Incompetent providers would join the ranks of EMS, and the profession could not maintain its integrity as providers of high-quality out-of-hospital care. Classic mentoring was an informal meeting of two people who shared a common interest, in this case emergency medicine. The relationship was largely unstructured and evolved haphazardly, depending on a high degree of trust and respect. But because goals were rarely defined, the resulting professional education was widely variable from one practitioner to another. A mentoring relationship is different from a preceptorship. In mentoring, a novice graduate paramedic would find a paramedic partner who would serve largely in an advisory role. This mentor would encourage the new paramedic to develop as a paramedic, examining his ideas and developing a more advanced concept map of paramedicine. In short, the mentor would help the new paramedic learn the art of paramedicine. A preceptorship is an instructional technique whereby a paramedic student is paired with a preceptor, a competent practicing paramedic who would encourage the student to achieve specific learning objectives. The preceptor helps the paramedic student learn the science of paramedicine. Generally, paramedic programs will accept any paramedic who has between 1 and 3 years of field experience and who is in good standing as a preceptor. However, this approach often falls short of the needs of the student. Paramedic students need preceptors who also have a willingness to teach and a desire to see the profession improve as a direct result of their interaction with the student. Preceptors who volunteer, by and large, have the qualities that are important to be a preceptor. However, effective preceptors are made, not born. Effective preceptors originate from programs that train the preceptor about adult learning principles, the EMS content and curriculum, as well as policies and procedures of the paramedic program. The importance of this training is to reinforce by requirements for training contained in the standards and guidelines for an accredited educational program for emergency medical technician paramedic. The field internship is governed by the standards and guidelines of the Committee on Accreditation for the EMS professions. The standard course of instruction for a student during an internship involves 3 phases: observation, participation, and leadership. The speed that a paramedic student progresses through these phases will vary with each student and each preceptor. The speed of this phase is increased when a student is with a small number of preceptors, preferably 1. Each paramedic intern goes through several phases during the internship. The speed that the intern progresses through these phases is highly variable and depends on both the intern and the preceptor. We'll also discuss the preceptor's roles in these phases. The observation phase. The student develops a relationship with the preceptor to see whether they fit. Invariably, personality conflicts will arise, and substitution can be done during this phase without harm to either party. The participation phase. The largest portion of the paramedic's clinical education, a paramedic student gets to practice the skills he has learned. Initially, paramedic students tend to stress the mechanical acts, those psychomotor skills that they learned in lab, such as starting an IV and intubating a patient. While these skills are important, the thinking skills must be stressed during this phase as well. Students should learn the process of obtaining a set of observations, such as signs and symptoms, establishing a pattern of symptoms, comparing them with others they have learned. Then they can develop a field impression or working diagnosis for the patient's treatment that is consistent with local or regional protocols and practices. The leadership phase. Does the paramedic student have the knowledge and skills to function as a minimally competent paramedic in the field? Of course, a novice paramedic generally has difficulties with a complex multi-system trauma patient or a compound illness. However, he should be able to competently manage a patient with a single system problem. Paramedic students are no longer required to spend a specific number of hours in the clinical and field internship phase of their education. The goal is skill and knowledge proficiency. Therefore, the number of hours listed are only guidelines. Based partially on your recommendations, the program director and medical director will decide when the student is proficient. The final amount of time spent in certain phases may be more or less than stated. In the first 24 hours, you should orient the intern to the ALS equipment in the ALS unit. The intern will perform BLS assessments and BLS skills. The intern may suggest ALS therapy, as well as function as an ALS technician. The preceptor will introduce the intern at the various receiving facilities. The intern will demonstrate the ability to locate and operate all BLS and ALS equipment, demonstrate the ability to perform a BLS assessment, provide BLS interventions to include definitive and supportive measures, make ALS equipment suggestions to the preceptor. And the intern will function as an ALS technician for the preceptor or team leader. In hours 25 through 50, the participation phase, give the intern hands-on experience in performing physical exams and vital signs. The intern may decide what ALS therapy is appropriate and function as the ALS technician. Emphasis should be placed on patient contact and patient needs. Perform a head-to-toe assessment on all patients encountered. Assess vital signs for all patients. Decide the appropriate ALS therapy and function as an ALS technician. From 50 to 75 hours, the intern will gather a patient's history, decide and delegate BLS and ALS therapy. They'll gather the patient's history and chief complaint, use mnemonics to support the history, such as PQRST, AMPLE, AEIOU tips, and others. They'll decide and delegate the appropriate ALS therapy based on the history gathered. From 75 hours to 150 hours, have the intern take a more active role in field management. The intern will perform the entire patient assessment, delegating ALS therapy, making radio contact to the hospital, and providing some scene control. They can perform a complete patient assessment, control patients, family, and bystanders, make radio reports. In hours 150 to 300, they should function as a team leader. The intern will function as the team leader. Emphasis will be placed on using protocols as guidelines, policies, and procedures. They should function as the ALS team leader on all calls, perform the patient assessment, make all treatment decisions, delegate treatment skills as appropriate, and maintain scene management. The primary internship objectives are for the intern to 1. Identify and manage a wide variety of patient conditions. A sample list is located in the Preceptor Manual, but this list is not all-inclusive. Number 2, to have a precise knowledge of pharmacology, such as the class, action, use, side effects, contraindications, and route of all medications and IV fluids carried by the agency. 3, to have a working knowledge of the agency's protocols and policies. Throughout the participation and leadership phases, the student is corrected and retested by his preceptor. This is critical to student learning and invaluable to the preceptor, who must make a final decision regarding the student's competency. On occasion, a student is not capable of successfully completing the internship under the conditions provided. In some cases, the student needs more time to practice skills or to learn material. These opportunities should be provided to the student through an extended or a second internship. In other cases, the student either lacks the aptitude or the attitude to become a paramedic. Attitude is generally more problematic for the preceptor. However, the preceptor should not hesitate to give a negative evaluation of a student. A negative evaluation provides a challenge to the student to improve. In some instances, that challenge is sufficient to get the student to consider alternative career options. The preceptor should not feel that he failed the student, but rather that he protected the patients from potentially incompetent paramedic provider and helped to maintain the integrity of the profession. It's important for the preceptor to know what is required of the intern to get them to this point. The program's hospital clinical experience is located in the Preceptor Manual. Please review at your leisure. Psychomotor skills are important, but equally important is the ability to handle the diverse patient populations that we see. An example of skills required are patient assessment on adult and pediatrics, intubation, bag valve mask ventilation, ECG interpretation to include 12 lead, medication administration, and proper radio transmission. Interns are required to have contact with a specific number of male and female patients. Age groups are broken down into 7 groups from newborn to adult and geriatric patients. The pathologies the intern is required to make contact with include OB/GYN, trauma, psychiatric, cardiac, stroke, medical, neurological that are from a non-CVA cause, and respiratory patients. Chief complaints the intern is required to see are chest pain, dyspnea, syncope, abdominal pain, acute altered mental status, obstetric, and extremity injuries. This is the end of Part 1. Please proceed to Part 2.